Hi, welcome to the Healthcare Communication Skills series. And this is a fresh talk where we will discuss communication in critical situations and emergencies. Now, normally we are interacting with the patient for their management or taking the history in the areas which are very much called like peaceful areas, like inpatients, outpatients, where we have the peaceful situation usually. And the patient is lying out on the bed, or the patient is coming peaceful, and we are trying to interact with them, asking the history. We have a time, we are alone sometimes, or with few staff, and there's no panic situation. But when we are dealing with the emergencies, even in the inpatients or mostly in the ER, we have a good communication skill series ourselves so that it will be easy to practice what we are trained for. So, we'll discuss further in detail about the communication in critical situations and in emergencies. We have to be calm, clear, and controlled. We should not panic. We should be clearly in our either orders or when we are doing anything. Like, for example, a trauma patient or a disaster situation occurred in the ER. The patient comes, three, four, five patients. You take the role of a physician who is taking care of the lower extremity, upper extremity, or a trauma surgeon, or you are working as a general surgeon and you take. So you loud out clearly, I am looking for the vitals of the patient with the staff and I am going to stabilize the patient's lower limb. You start examining the abdomen, or you start looking for this bandage, or you start looking for this, and you have to tell the names of the people who are assigned the different roles. If you are not the team leader, you look for the team leader who will assign you the specific role, and you go on with it and stick to it until you complete your part of the management. What is the mean of clarity? It is life and death. So we should clarify our roles while managing the patient so that the duplication is avoided and there is less chances of error. And it enhances the coordination. And whatever you are doing should not be repeated by your colleague on the same patient. So stress distorts communication, but structured communication restores control. So it means if you are clear in your management plans or your strategy, it will enhance the management of patient and outcome of the management. Usually the techniques we used are the closed loop communication skills. We have to use the name and the eye contact while communicating something or giving the order to our subordinates or our colleagues or while communicating to our colleagues. So you have to speak in short, direct phrases to avoid the time, to avoid the wastage of time, and to avoid the skills what you are doing to from wasting it. While we are working in the emergency areas and in critical situation, we have to assign the roles. If team leader is there, he will assign the role automatically, and the people will behave or work according to this rules. So tasks are assigned explicitly and confirm complication at the end of the completion at the end of the task. Like for example, somebody has done the task. He says, "I did this task." It encourages everybody to give their own updates so that we will see at what stage our management plan is running or we are going with the timeline or not. So, after dealing with this critical situation, will be a debrief after the event. In this debrief, we will see what has been done and what are the gaps in between. You have to encourage the input from your colleagues, even it is there are mistakes occurring during the event with you or your immediate colleague, and it this input will help you to improve the outcome in the future. Also, the leader should be talking with a calm set of tone and should not blame their colleagues or the people who have been the part of the disaster management during the event. What are the common mistakes that we are doing while attending a disaster situation or an emergency situation? There are multiple peoples giving the command to different peoples, and they are not able to apprehend this command and they are not able to understand that command, and they do their own work according to their pace because they are confused while receiving the command from multiple people. So, if there is a leader assigned, he should assign a specific task very fast, very brief, and avoid the background noise. And one person speaks, the other person can speak about the updates, and you have to acknowledge at the end of the event that this has been done and the people who have been involved in this event, and try to establish the diagnosis or management or treatment of the patient. So if you acknowledge them, their ability will be increased. Therefore, it is mandatory to say that the clear and good communication saves many lives and saves too much time while doing the tasks. So, calm words and clear minds will help us in our management of the patient during the disaster and critical situations. Thank you. This is end of this talk. I hope you have enjoyed this talk. Thank you.